Hi, I'm Talaja Taylor, a senior at Fisk University, partner with the HBCU Wellness Program at Meharry Medical College, and today I will be discussing my research project, Building Healthy Beginnings, Combating Maternal Mortality Through Preconception Health. So a little bit of background on my project and why I believe it's important. As you can see from the graph, that maternal mortality rates are continuing to rise in the United States, with Black women being disproportionately affected with higher risk compared to other racial groups, with Native American and Alaskan Natives coming to a close second. Preventable maternal deaths reflect gaps in preconception health education and access to care, especially in North Nashville where my university is located. Limited awareness of risk factors, socioeconomic status, and inadequate preventative screening are huge contributing factors to the high maternity mortality rates. So I believe that strengthening preconception knowledge and knowing early signs of risk recognition is critical to reducing preventable maternal mortality and improving birth outcomes. Although we cannot change medical bias and medical practices, it is our job as a community to educate individuals. So, as stated before, the purpose of my research question for this project is, will participants' knowledge surrounding preconception health increase after informational presentation? It's so important that culturally responsive educational interventions are used as strategy because it will help in reducing preventative maternal health disparities. So here are a few of my methods. For recruitment, I use digital flyers that were shared through Instagram and Twitter and GroupMe. And I chose these platforms because they targeted women age 18 through 35, and those are the platforms that they use the most. By design, I use a single session educational intervention with pre and post assessment, and my facilitator was Dr. Leah Alexander, the founder and director of the Maternal Health Equity Research Center at Meharry Medical College. And then for my data collection, I use surveys administered via Zoom to assess knowledge of preconception health, maternal mortality, and risk reduction strategies. So here's an example of some of my results. In both these graphs, a question was asked, how well does the participants understand how preconception health affects birth outcomes? In the first graph, you can see that there is a wide percentage that is neutral, and then there's a 9.1% that disagree. So don't feel too well understanding the correlation between the two. However, by the end of the session, about 40.9% and 54.5% agreed or strongly agreed with that neutral gap, lowering down about 4.5%. So with that post-intervention response demonstrated a 41 increase in knowledge, with almost 96% of participants indicating an improved of understanding. This indicates that targeted educational interventions can meaningfully improve awareness of maternal health risk factors, especially in ways that the community can understand. So in conclusion, this study demonstrates that brief targeted preconception health education can significantly improve maternal mortality awareness among women in Nashville. So here are some of my future plans. I hope to implement a multi-session in-person programming to enhance engagement. In-person events tend to have higher participation, and more interactivity can help information retain better. And I hope to conduct follow-up assessments to evaluate knowledge retention and to see their behavioral changes to see if the information has impacted their livelihood. Lastly, I hope to expand partnerships with local healthcare providers to integrate preconception education into routine care. This is one of my most important steps, as finding women's health care as a college student, especially out of state, is fairly hard. And this would be a great opportunity to connect the community. So thank you for listening, and thank you for your consideration. Here are my references and my unique gaming code. Have a good one.